OA developed a running and gait assessment program about 7 or 8 years ago, and it was kind of to fill that niche in the area to support some of the runners that come in that may be injured or not injured. We want to make sure that we're kind of taking runners in the area and being able to kind of take them to the next level. So an assessment starts with a PT evaluation. We assess the patient, we look at everything from strength, flexibility, mobility, and then the second piece to it is we put them on the treadmill, we take some time, we look at their mechanics, which is often a piece that's kind of missed. If the treadmill is not appropriate, some patients don't enjoy being on the treadmill or aren't necessarily comfortable or showing a realistic gait. We'll take them outside and we'll actually do some running kind of in the parking lot or a local area so that we can really assess their mechanics in a more natural setting. So one of the things that often gets missed with runners is truly what their mechanics look like. A lot of runners will go into rehab and they'll end up looking at their strength, they'll look at their flexibility, and they'll find kind of deficits. They'll work on those and they'll get those back to a fairly normal level, but the problem is that once they get back on the roads, their pain comes back. One of the things that often happens is their mechanics aren't kind of sound. There might be something that's happening while they're running that actually could be the component that's affecting them. And to re-educate somebody's gait is not something that just says, hey, run differently. A lot of people have small things in their gait that might come up or the way they run that takes some time, but a lot of it starts with drills. We start basic, we work on different drills until somebody can do those drills well, and then we progress that towards a running pattern. We work with any kind of running athlete, so it could be a soccer player, a football player, somebody that is a weekend warrior runner, it could be the most competitive, Boston marathoner. The assessment's anything to look at somebody that may be having symptoms when running or somebody that's looking to prevent an injury from running. So when somebody comes in for the running and gait assessment, this is going to start with an examination. What that's going to entail is taking the patient from top to bottom, looking at the way they move. We'll check flexibility, we're going to check strength, and we're going to look at them kind of as a whole. We'll go through injury history, we'll look at footwear, we're going to assess any kind of wear patterns kind of on their shoes, things like that that could play into it. And then we'll take the patient, once we've kind of gone through that full assessment, we actually kind of get into the running portion of it. The running portion looks at a video analysis of the person's gait. So we'll put them on the treadmill or outside, we'll break down all of their running mechanics, and then we take that and we upload that onto the computer. We sit down with the patient, we go through all of those mechanics and we look at any kind of angles that might be coming up, the way the patient moves, anything that could be jumping out. Once we've broken that down, we'll give the patient some of the videos so they can kind of look at it on their own. We may end up passing that on to other healthcare providers. And then also we'll take that kind of video component and be able to say, okay, can we come back and kind of recheck this in a couple weeks? From this stuff that we find through the videos, this will give us more information to kind of be able to kind of gear the patient's kind of direction after that. This could be an exercise program, this could be a strength progression, this could be running mechanics. Typically it's a combination. We have 2 different ways that you can do the running and gait assessment with us. You can come in as a cash pay assessment. A lot of these are people that have not had injuries or have had injuries in the past but not currently. The other way is that you could see a physician that could refer you directly to us and may do it as part of a rehab program.